Thank you. Thank you very much, Dan. It's such a pleasure to be here, and I really appreciate the opportunity to be here with all of you who are truly on the front lines of dealing with the mental and behavioral health needs that we have. I'm here today to talk about Senate Bill 255, which I'm really honored to carry. But before I dive into that, I just wanted to say that, on a personal level, I'm just so thrilled that this issue is now front and center. For some of you who have heard me speak before, you may know that when I was in high school, I suffered with anorexia, bulimia, and was suicidal at points. And it was only because my mom was there and she was so strong and she was able to get me into the care that I needed. Just seeing a therapist weekly for literally 2.5 years. And we had the privilege and the access to be able to do that. But, I know, now I have 2 teenage girls of my own, they're 13 and 17, and I watch what's going on with our young people and, whatever I can do to help. But I share that story with you because the thing that I needed to hear at that point in my life was it's possible to get through this, and it's possible to come out the other side. So share my story. If you have clients who need to hear it, tell them that it's possible to survive. So anyways, we all know that our kids and our youth are struggling. Even before the pandemic, they were struggling. That's why we worked so carefully on the blueprint to make sure that eventually there's going to be $125 million in there for community supports partnerships to help our youth through the school setting. But at this point in time, I'm working on this package, right, that Senator Gazzoni mentioned. And the piece that we're focusing on is these specific children who wind up repeatedly in the emergency room. And they're ready for discharge and they don't leave. And they don't leave because their parents are afraid to take them home because they might hurt themselves. They don't have that accessible plan of care once they leave. And so Senate Bill 255 is going to address this. And just a bit of history so you understand where this bill is coming from. Prior to 2014, the state of Maryland supported approximately 300 to 400 children per year who had serious mental health issues. Those were at risk of harm or of aggression. And they supported these kids with state funding for coordination of support services. Then in 2014, the state began working on a program called the 1915I program, which leverages Medicaid. Great idea and concept. This program was designed to serve children with serious mental health needs in order to prevent them from going to the emergency room, hospitalization, or other higher levels of care. At its core, it's a diversion program. It was projected to reach 200 kids a year, so it was not quite the 300 that we were doing previously. But in reality, between fiscal years 19 and 21, when you look at how many kids were served, it's a total of 34 kids. So what happened to these kids? We had 300 to 400 kids we were supporting, and we moved to 34 over 3 years. Those missing children are the ones who are in the emergency room, who are struggling and asking for help. So clearly the program's not working as anticipated, and even the Maryland Department of Health recognizes the need to improve this program, and they tried to loosen their eligibility requirements, both financial and medically necessary, but it just hasn't worked. And one of the problems is that the low reimbursement rates for this system of diversion programs and the high fidelity wraparound services that can keep kids out of the hospital. And so Senate Bill 255 takes the necessary steps to improve the hospital diversion and to restore the balance in the children's continuum of care. And so in a nutshell, it does 4 things. It tackles a lot of these known barriers to entry into the 1915I utilization program. It actually funds the high fidelity wraparound services. These are evidence-based practices at rates that are commensurate with industry standards. And then it funds targeted case management services for an additional 50 children who are not eligible for Medicare. And finally, it funds a value-based payment pilot to treat children with these intensive needs and incentivize the outcomes such as hospital diversion and family preservation. So it also makes, we know it's the right thing to do. We need to get these kids, divert them from the hospital, get them the high care that they and their families need. It also makes financial sense. The 1915I program is a cost-effective strategy. It costs approximately $2,500 per child per year. And this is 1/10 the average hospitalization cost, which is about $26,000 per child, and just 3% of the average residential treatment cost, which is $77,000 per child. This makes financial sense, and it will save children's lives. So this legislation overall will strengthen the continuum of services going to those families who need it most. And I am just really honored to be part of, a small group of us who are working and gaining steam with the Maryland Association and many others, and really appreciate, your all support in raising the profile of this and so many other issues. And so if I can, be of any help in any way, don't be afraid to reach out. But I'm just really honored and thankful to get this going, and I know with the support of my Senate colleagues, the House colleagues, and the governor, we'll get this done. Thank you so much.